Hey guys, so I am supposed to be packing right now, as I have been supposed to be packing all day, and I am not. I'm procrastinating mainly because I really don't want to go to the hospital in less than 12 hours. It's 1:30 in the morning now. I finally started packing. I got out my bag, and then I got distracted and I started watching my surgery because my surgeon put my surgery on this awesome hard drive for me. So I have my entire surgery. So I have proof that I have a brain, that there's actually a brain inside and it's not just space. So of course I can't have a normal brain. When I found out I had a brain and I had my MRI done, the first one, I had actually had joked and I said, good luck finding a brain in there because it's probably all air. And then come to find out, sure enough, I do have a brain, but not only do I have a brain, I have too much of a brain. So it's like, go figure. That would be my luck. And now, unfortunately, I'm still having intracranial hypertension, which means that my brain is producing too much spinal fluid, so my body can't release the spinal fluid fast enough, as fast as it's producing. So it's actually flooding my brain. So, like, with babies, you see babies when they have this problem, they have like really big alien heads, and that's because with babies, their skulls are soft. And so their skulls can actually expand to help relieve some of that pressure. With adults, our skulls are actually hardened, and so our skulls won't expand. So instead, it is just squishing everything inside the brain, which is really, really bad. That's why I have this droopy eye. It's damaging the muscles underneath my face all the way around. And so every day it's damaging it more and more and more. And so if the problem's not fixed, eventually it will just completely damage it, and I'll be like this all the time, basically. So not only did I have too much in my brain, but I also have an overachieving brain that wants to be overproducing crap. So, just my luck to have that. So, I go in to ICU for testing. I have not yawned one time until I started doing this video. There is something about this video. Oh, I bore myself to sleep. How fantastic is that? Because I only start yawning when I start doing these videos. So, I am so sorry that I make y'all yawn and if I bore y'all to sleep as well. So, you're not alone, because apparently I do it to myself, and my cat's nice and asleep down here in my arms as well, so apparently I have also bored him to sleep. That, or it's because I'm also petting him. So, okay, back to where I was. Dang it, I lost it. Oh yeah. So, I'm going. See, I'm so boring. So I go into ICU tomorrow, or today technically, because it's after midnight, and I spend a week in ICU at least, where they're going to do testing on me. So basically what they're going to do is put this tube, a catheter, into my spine, to check my spinal fluid pressure and to relieve my spinal fluid, to drain it out. So it's really dangerous and it's really risky because it can chance infection, and any kind of infection like that is really, really bad because you get an infection in the spine, you're most likely going to die, basically, is how that works. And so I will be laid up on my side for a week, which is going to suck. So I'm going to have a whole lot of nothing to do. Thankfully, one of my good friends bought me a couple of adult coloring books. Ow! I don't know why you think you have to randomly bite me like that. Yeah, no, not cool. Sorry. I'm apparently boring him so much he thinks he needs to bite me now. So yeah, so I'm really excited because I'm going to try to talk them into laying me on my left side, so that way I still have my right hand to use because I'm right-handed, so that way I can still use my coloring books and color. I'll probably end up coloring the entire thing. Gosh, I really suck at not yawning in these videos, and that helps. It's like 1:30 in the morning. So my other friend, also my boss, as you all know her, Sarah, got me some audiobooks, books on tape from the library. She got me some looming stuff if I am able to actually use both hands. So I'm going to start looming because God knows when I'm going to be able to go back to work, if I'm ever going to be able to go back to work. So I'm thinking maybe I can start making like some headbands, some hats, or scarves, or whatever. I've made one headband and it turned out really great. So if anybody wants to buy one and place an order, let me know. I will have a lot of time on my hand. So if at the end of the week from this testing, if the testing concludes, yes, I need a shunt, then they will do a shunt surgery. This shunt surgery is pretty crappy. It starts from the brain, and the surgery literally starts here, and they put a tube inside underneath the skin all the way down, and then it ends in the bladder. So it's a pretty extensive surgery. It typically has to get redone quite often as well because spinal fluid is thick like honey, and so the tube actually gets clogged quite often. We worked so hard to save my hair. I know hair seems like a really petty thing with something like this, but we did. We worked really hard to save my hair, and with the surgery, my head will have to be shaved, at least from here all the way down to here. Now, I know like a year ago, they rocked out like that whole like buzz cut right here on the side of the head, but the rest of the hair was pretty long, and I chopped off my hair short. Go figure. So I don't know. I figured out why my cat's been biting me, by the way. It's because I talk with my hands and I keep like smacking him with my hands. Whoops. Anyway, so, but I don't know if I can like pull off the whole like head shaved. So I've been looking into wigs. I've always wanted, like, I've literally have always wanted to shave my head bald and get a wig because I cannot do cute stuff with my own hair, but I can do super cute stuff on other people's hair. So if I can set and do somebody's hair or do my own hair, you know, like on a mannequin like this, then I can actually have cute hairstyles every day. Plus, my arms can't be held up that long to do my hair typically. So, I'm really sorry. So yeah. So, I'm trying to look at the bright side of things, positive side of things. So, I've really been having a hard time all week about if I have to have this surgery, about whether or not I'll actually let them do this surgery. The alternative is pretty extensive. It's basically like lose my sight, go into a coma, and then die. Is typically the alternative, because I'm on a lot of medication now for it, and it's not working. Like today my face is super swollen because my pressure is really high today. That's why like my eye over here is almost closed. So we've been trying to do the alternative away from surgery, and it's just not happening. But with this surgery, most people don't ever go back to work. They live on disability for the rest of their lives. Requires many reversions, which means multiple surgeries. I would never be able to weightlift again and work out. And that's a huge part of my life. A huge part of my life. And not ready to give that up, even though I can't currently do that now. But like, even just being out of it since I haven't done it since the end of July, I've been just itching to go back, and it's been driving me nuts. I'm so ready to get back to it. My body's ready to get back to it, and so I've honestly really been struggling, and I've been struggling with God with it of, how much is enough, when is enough. God has definitely laid it on my heart that He wants me to start a life group to help other people that are going through chronically ill problems. And so I knew that's why God allowed me to go through the first one. And He brought me through it, through the surgery and everything. But I feel like I don't need to go through more to be able to relate to other people that I've gone through enough. Today I kind of hit a huge reality check of just the fact that there's so many people that go through so much more than I'm going through, and I've been overly blessed, way more than I ever could imagine or ever deserved. I was sitting in the nursing room today, obviously not because I was nursing, but because it's quieter. I'm able to watch service in the nursing room. I had already watched service once, but I went in there to watch it again in a quieter space, and this lady came in, a stranger. She actually didn't know my story. God definitely sent her in there to talk to me, and it was definitely what I needed. So basically, we talked back and forth. She shared a few different things about her past. I shared with her about my surgery, and then I also told her about the fact of how I wasn't scared with the first surgery, and so she asked me why. And so I told her it was because, I went to this revival at a church, and a complete stranger came up to me, right? Well, first God told me, my child, in my time you will be okay. He told me that clear as day, and then right after that He sent a complete stranger up to me to tell me that it was all the matter of the mind. Well, the matter of the brain is a brain tumor. And he just kept going like this, and he said, you just got to get it out of your head, and you will be okay. This isn't your battle. This is God's battle, and it's already won. Quit worrying about it, and just let it go. And so, so I'm telling her this, and she tells me that, God's true to His word. He's always true to His word. And I agreed, because I know that He's always true to His word. And so she said, that God didn't say that you'll be okay just after, I'm only going to make you okay for this one surgery, but that you're going to be okay. So that didn't mean just after that one surgery. And so it could be after an additional surgery that you're going to be just fine, or that the surgery's not even needed after the testing, or whatever the case may be, but you will still be okay. That God still got this. And if you've been following these, that's been my phrase is God's got this. All the way through my brain tumor journey was God's got this. So I definitely know that God sent her to me to open my eyes and to help me quit struggling and make me realize that He does still have this, and it's okay to be scared, but that there's no reason to be. So just gonna leave you with that. I definitely needed that today. More than words can say, and so I'm definitely thankful that God sent her to talk to me. So I'm going to bring my laptop with me to the hospital, so I will try to continue these, maybe show you somehow. Don't really know how I'll make that happen, but somehow I'll try to show you like the awesome tube hanging out of my back if you like gross stuff. Definitely you can check out my Facebook page and see some awesome pictures from the video. I've got a picture of him holding the piece of my skull in his hand, and a picture of my brain opened up. Told you I've got proof that there's one in there. It just didn't exactly work properly. And then if you scroll down in the comments, it actually has a picture of what my actual tumor looks like. White, weird looking. I didn't post the picture, but actually behind it, he had to scrape off a lot of stuff. I wasn't really able to take a picture of that, but it was black and disgusting looking that was in my brain. So yeah, that's all I got. I'm really gonna just leave you with that now. I know I already said that once, but I'm really done now. So I hope you all have a fabulous night. And if you have any questions, please comment and let me know what your questions are, and I will definitely answer them. And if there's anything specific that you want to see or you want to know, just let me know and I will tell you. Thanks for watching.